6:30 p.m. on June 11th, 2025. I'll call to start the Town of Bourne Board of Health meeting. And the meeting will also be televised on Zoom, and Zoom chat will not be monitored. Participants who wish to speak must raise the hand icon until the chair asks them to unmute. Note that this meeting is being televised and recorded by Bourne Community TV for replay. If anyone in the audience is also recording or videotaping, they need to acknowledge such at this time. All items within the meeting agenda are subject to deliberation and votes by the Board of Health. Is anybody videotaping or recording? Okay, hearing none. If anyone from the public wishes to access the meeting remotely, they can do so by clicking the Zoom link or by calling the following conference line on their phone and using the Zoom meeting ID and password below. The dial-in is 1-309-205-3325, and the meeting ID is 315-403-5336, and password is 02532. So first item is to take attendance. Margaret Reale?
Here.
Dusty Meyer?
Here.
Miguel Prieto?
Here.
And I'd like to introduce our new board member, Don Ellis.
Here.
Here. And Bob Collette. Here. So, Mr. Ellis, would you like to just tell us a little bit about yourself? Take a moment to tell the public about your background.
Yes, thank you. I have had 5 years of experience with the Board of Health at North Reading back in the early mid-90s. So I have been quite familiar with the Title V, and I have been a construction manager for 45 years, and former Coast Guard as well. So I have some years of experience there. So if anybody has any questions at any time, I'm open to conversations into my background, but
Okay.
I have an open book when it comes to that. All right?
Thank you and welcome aboard.
Thank you very much. Thank you.
Okay, so item number 3, 233 Scraggy Neck Road, Cape and Islands Engineering, on behalf of applicants James K. McCurdy and Ann C. Pardee, trustees, requesting relief from Bourne Board of Health 150-foot setback regulation and 310 CMR 15 for the installation of an IA septic system, including the following variances. 117.7-foot waiver for a setback distance of 32.3 feet from the soil absorption system to a bordering vegetated wetland, coastal bank, and salt marsh, and a half-foot waiver for a setback distance of 9.5 feet from the septic tank to a slab foundation. Sir, would you like to state your name for the record, please?
Good afternoon, Mark Dibb with Cape and Islands Engineering, representing the applicant at 233 Scraggy Neck Road for a couple variances request. So this is an existing house on a 3-acre lot, well, 2.97 acre lot on Scraggy Neck. The system is in need of repair and upgrade. There's actually no paperwork regarding what's in the ground for the system. We believe it's just a pipe out to a cesspool. So we want to fully upgrade the system. There's no additions, or it's not a tear down rebuild, strictly repair of a 3-bedroom system. We've cited it really the best possible location. It'd be a little better if we could get out to the roadway, but you know, we'd have to trespass through some wetlands to get there. So we've tried to pick the best location for the leach field. And what that does is puts us 32.3 feet away from coastal bank and 85.7 feet away from a wetland in that, towards that green area. We did provide nitrogen loading calculations, which came up to a 2.17 parts per million loading for this property. You know, it's a 3-acre property with 3 bedrooms, so you know it is a big system. We are at this time proposing a fast IA system, and those calculations were based on the IA system at the 25 parts per million, right on that. We've shown that as what we're proposing. We did receive conservation approval last week, and I'd be happy to answer any questions, if anybody has any.
So, if you don't mind, your 117.7 feet setback distance there, can you show me where that, how you came up with that? I found 118.2, but that's a corner set of stairs and not back to the system, to the IA system, which is, I can find 85.7.
That's actually the relief we're seeking. The actual setback is 32.3. So 117.7 is 150 minus 32.3. So 117.7 isn't really a, it's kind of the relief we're seeking, if that makes sense. The actual setback is this 32.3 right here.
Yep.
So the math, 150 minus 32.3 is the 117. So it might be just confusing to you. I would look at that. The proposed column is the actual proposed setback. 32.3 does not meet your 150 feet from a coastal bank.
So the design was able to attain 32.3, not the 150.
Correct.
So that's the difference that you are seeking waiver. Okay.
I have a question. Under general notes on your plan, it says an interior inspection of the building was not performed. So I'm just wondering, this floor plan is this sketch here. It's not really an official, floor plan. So has anybody been in the building?
So typically for just an upgrade with no proposed work, so we're upgrading a failed cesspool based off of Title V, we would not do a walkthrough. We would go based off of their provided floor plans.
Okay, all right.
That is a sketch provided from the homeowner. It is assessed at 3 bedrooms. I believe what he gave me was accurate, but I personally also did not walk through, and there just isn't like actual architectural existing floor plans since there's no addition being added or anything like that. But it could definitely have a condition of a walkthrough prior to installation if need be. But we do believe there's 3 bedrooms, and that's a general sketch of the layout from the homeowner.
Okay. It does say in the bedroom definition, the update of the bedroom definition in 2022, that, floor plans be provided, and, something that you could tell
So yeah,
for sure.
That would be the floor plan that they
Yeah,
provided.
yeah.
So that's typically what we get with every septic upgrade that gets submitted to our office. That's not required. If they're doing a proposed renovation or addition, we'll ask for proposed versus existing.
Okay, all right.
Okay, here we go.
No, my question was based on the previous meeting when we discussion about bedrooms and stuff that I couldn't really say how many bedrooms there were. So I know what you're saying, they're not gonna make it, so that might be it. But if we approve something for 3 bedrooms and there's more, based on the sketch, not the plans, those are sketches, because I saw the definition too, that the sunroom or family room counts as bedrooms, but you guys know more, so I just want to bring it up to the board and see what you can tell me about that.
So with the lower level here, being where they have, it appears their lower level has a family room and 2 bedrooms and then a bathroom. The family room would act as like a foyer entering into both those bedrooms, so that'd be a walk-through room, wouldn't be considered a bedroom. And then downstairs, upstairs, I think that might be flipped actually, because the garage is on the upper level. So, same thing, I'm assuming the stairs would come up to the family room, and then you'd enter into both bedrooms. So family room would still be a walk-through room, based off of the Board of Health definition. And then downstairs, the bedroom's at the back of this room here, so we're assuming that there's an entrance between one of these areas. They appear to have a cased opening to the sunroom, So that would eliminate the bedroom criteria for an existing home.
Right.
So, okay, so the opening, a cased opening, I didn't notice that. In other words, I thought it was the width of the opening.
So for new construction, you'd need that 6-foot cased opening. A cased opening in existence could be as little as 4 feet, as long as it's existing, and they have it demarked out as a cased opening, so that's, I would assume it's at least that wide.
So anyway, we're kind of going on about it a little bit, because without anyone ever checking it, we're just taking the word of the people, right? So they could actually have more bedrooms, but be only putting in a system that is only for 3 bedrooms. That's why we're bringing that up, of a concern, having it not ever been visualized. Another thing too, this is just a question. It says a slab foundation, and according to the record card, it does talk about a basement. It says on the record card, it says that there is a basement, which is, I have a copy of it.
It has an area for finish and unfinished on the record card, that's
Yeah.
true.
Yeah, let's see. If I'm understanding this correctly, under description, it has basement unfinished and basement finished, it says. So
Yeah,
do you know anything about that?
Yeah, it's like a walkout. You can see elevation 12 here and elevation 18, 19 in front. So, yeah, at the lower level could be considered a basement. The reference to slab is the garage, though. Does not have a basement under it. So the dimension of the tank to the garage corner is definitely a dimension to a slab foundation. There's no basement under the garage portion. That's where we're being.
No, not usually. Garages don't usually have a basement.
Right. Dusty, were you satisfied with the information that?
Yeah, I just misread this, and I read it 3 times, 117.7, and then wavered, and then 32.3. That's a big difference.
Yeah. Okay. Katie, did you have any further comment on anything here? This is the best possible scenario for this?
Yeah, like you said, they cited it the best they could on this lot, for where we're at. They're providing nitrogen reduction, for an upgrade automatically, reducing our nitrogen loading in that area, which is an impaired area. So yeah, I mean, this is a huge environmental benefit compared to what's there currently.
Okay. Any further questions, discussion? Entertain a motion?
Sure.
Okay. Make a motion for 233 Scraggy Neck Road. Cape and Island Engineering on behalf of the applicant James A. McGurdy and Anna C. Party for approval.
I second it.
You got a second? Okay. Mr. Ellis?
I also third it with the notation that it's a reduction.
Yeah. Okay. Margaret?
Yes?
Yes. Bob, yes. Okay, thank you. You're all set, sir.
Thank you.
Not a problem.
Only problem is that it's this close to the end.
From being so damn.
All right. Okay, number 4, public comment on non-agenda items. Anybody from the public on Zoom? No? Okay. On to number 5, any comments from the board regarding future agenda items?
Yes.
No.
So, for the next wellness event, what I'm planning to do is, because I talked to several people, I I guess I had a lot of roadblocks with the U.S. Corps of Engineers requiring all these different things and so on.
Yeah.
So I talked to the people at the Upper Tech, and they're willing to host us there. They will provide security detail. They have plenty of parking there for us. They have trails, so we could do, I have to measure if I can fit the 5K there. And I'll talk to the superintendent there, Roger. You know Roger?
Yeah.
Yeah. To see if we can, what else we can do. But certainly, the question is, I just don't know if what you guys think. Are we gonna get the foot traffic that we want?
I think so. I would say so. If, I think it was unfortunate that the weather wasn't so hot this year, and, we learned a lot of things along the way. I know that you did a lot of work,
Yes.
and, those types of things do tend to take a few years to gain momentum, a couple of years anyway, until word gets around, and I think it is potential. I'm all for it. I think potentially that'd be a wonderful annual event.
I think that we don't have to do it so early, so it's less chance of being miserable. It was miserable that day. It really
It was cold and wet.
Yeah.
And, but we still got people.
We did.
How many of those socks do you give out?
We ran out of all of our adult pairs that I brought.
Beautiful.
Okay,
So, yeah,
wonderful.
which was amazing.
The food almost ran out, too.
Yeah, there's only a
and,
couple things remaining there.
It was good.
Yeah. So, a good start, and then I think we can build on it, and I'm all for it, and I'll support you in any way that I can too. It's right up my alley.
I think a lot of the UCT events are really well attended, so I mean, as long as we get like a flyer that we can put out everywhere, get it shared on social media,
And
maybe.
we'll do it with plenty time in that.
Yeah,
so we
exactly.
can circulate,
And they'll also promote it,
Yeah, exactly,
you
they
know,
will, so.
right? And we'll get the enterprise involved again and that kind of thing, so. Yeah, thank you for all the work that you did on that. We got it started, and hopefully we can build on it moving forward. Anybody else? Any comments? No? Okay. Rusty?
Depending upon the workload, you foresee us not meeting in one of the months, April? I know that's a hard thing. You don't know who's gonna walk in.
In like July, August,
Yeah, summer's a hard time.
summer's a hard time to gauge it. We've been kind of slow on submissions. Summers usually tend to be when we work on regulation changes. So,
Right.
I mean, we can aim to have one meeting a month scheduled for those, and if we get any submissions, we'll try and put it in there. If not, if we get too many, we'll spread it out, but.
See, that's the only time we have good weather.
I know,
That
right?
we can enjoy. And that.
really
And
want-
I have a little one
The system's in.
wants to be
right?
with grandpa and go places.
I will say that I don't foresee us getting a lot of submissions for the first July meeting. It
And I-
being 3 days after 4th of
I
July.
fully
or
understand the
whatever, yeah.
contractor's wishes. They gotta get the systems in the ground. They try to
Yeah.
before winter sets
Right,
in,
yeah.
or at least get approved.
Yeah.
I bet I did. I think last year, didn't we do something like that last year? Right, in one
Yeah.
meeting or
One meeting was specifically, yeah.
per month?
Didn't we also ask them, we warned them that that was coming and get your project in earlier or
Yeah.
later?
Don't remember that, but yes, that obviously would be a wise thing to do.
It looks like last year we did not have our second June meeting, and we did not have our first September meeting, but we did have executive and emergency meetings kind of scattered around.
Okay. All right.
Do we have any summary or anything of what happened with the meeting with the council? I just couldn't cancel patients to come.
Which meeting?
It was at 1
With
PM.
the selectmen's meeting.
Oh, the one you attended.
No, that was 3 PM. That's
Oh.
another
That
meeting
was-
that I
oh.
couldn't make either.
The council on
The,
aging.
The open meeting law workshop, is that?
Oh,
Is that what it was? It was
Yeah.
a meeting with the town council.
Town
town
council,
council,
yes.
yeah. He was just kind of giving a PowerPoint presentation on public hearings.
Are those slides available?
Yes, I
they
will
are.
share those with you guys.
Okay. Yeah, that'd be nice.
Speaking of, we do have a public hearing or at our next meeting. It's a part of our next meeting, which will include discussing the proposed regulation that you guys all got as well, so. Bob,
So
we
how
can-
are they different from the previous one?
So they have to be advertised in the newspaper for 2 weeks prior. So it went out in the Cape Cod Times last Sunday and will go again this week as well. And then it has to be posted in our office. We have to accept public comment leading up to it. So we have a time frame for public comment, written public comment, to be cut off the Friday before that meeting. So we can email you guys all those things prior to the week of the meeting, so you can read through it. And then it just has to be, we have to open the public hearing within our meeting and close the public hearing within our meeting as well.
Now, did that come out of the joint meeting that we had with the select board?
It had, the joint meeting that we had this past winter. So not this past one we had, but we had a joint meeting.
Right.
And we discussed, ways that we could help maintain nitrogen reduction in areas that, if the town opted for a sewer plan. Cause that would cut off, instead of having 1,000 properties upgrade their septic systems, we would only have 200 connect to the sewer. But we didn't want people who were gonna now expand on their properties, not on town sewer, to negate the work that sewer was doing for that watershed. So, that was discussed between the select board and the Board of Health at the time, that would be a potential regulation that we would discuss.
Okay.
And this will apply even if the town applies for the waiver?
Yes.
Okay. All right, so moving on, number 6, approval of minutes from the meetings, March 26th, 2025, April 9th, and April 23rd, and also May 28th. So we'll have one of those here.
I don't believe you have May 28th.
We don't
yet.
have May, right?
Yeah.
So, March 26th. I think this is the one where, Miguel, there was a typo, or you were,
No, it was the 9th.
or the 9th.
That's okay, we're gonna leave that out. I
Okay.
was there by Zoom and not personally, I guess I was
Okay.
not counted in.
Ah,
You were not there either, though, that day.
on March 9th?
Yeah, it says he's here.
April 9th.
I was here on April 9th, but not April.
Were you?
No,
Well,
this-
that's when we were, maybe I got the wrong meeting.
Maybe.
Is that the meeting where we were doing the
We had 2 meetings with tobacco violations.
tobacco
Okay,
violations?
so, yeah.
One he was not here for.
That was
So I was for that one. That was not April 9th?
No.
April 23rd, it says Miguel by Zoom. Dr.
Okay, so
Miguel.
maybe, see, I was wrong.
You knew you were here for tobacco.
So,
So, would anybody care to?
I move, yeah, I move to accept the minutes for March 26th.
I second that. That was accurate. I read it.
Anything else there? And Dusty?
I'd like to make a motion to approve April 9th.
Wait, we have to finish approving March 26th.
I'm not, okay, second.
No, you just gotta,
Miguel already said.
What do you want from
I
me?
want a yes vote.
yeah, we're all here,
yes.
so it could be an
Yes.
all in favor, you can say all in favor,
All in
say,
favor?
yeah.
Say aye, yeah.
Aye. You say it again.
I don't believe we can do that.
Okay,
Yeah, you're all
Can,
here.
Yep.
okay.
It's
Oh,
only if one
that's
of you is,
right.
you only need a roll call vote if someone is on Zoom.
Okay.
Okay, and April 9th? Let's see, April 9th here?
I already did.
Try it again.
Make a motion to approve the minutes from April 9th?
April 9th,
Okay,
correct.
all in agreement, say aye.
Aye.
Aye. Okay. And then we need a motion to approve
April 23rd.
April 23rd.
Make a motion to approve April 23rd, 2025.
Okay, and I have to abstain because I was not here.
I second.
Was I there?
Yes, okay. Okay.
I
Miguel,
second.
second. Margaret?
Yes.
Yes, okay, so they're set. All right. And then I will entertain a motion to adjourn.
I make a motion to adjourn the meeting.
All in agreement? Say aye. Aye. Okay. Thank you. Quick and easy.